One of the questions we get a lot to ask people like yourself is, what would you recommend to somebody who just gets that diagnosis? And every diagnosis can be different in terms of what stage people are in cancer, but a lot of times you hear, we can get you in and start treatment tomorrow or next week, right away with the chemo or the radiation. What would you suggest to someone who's sitting on the other side of that?
You know, number one, I say, relax. Remember, I was, weeks away from dying. I don't think very many people are that far away. Is number one, you have to relax. It took you years to get this way. You have some time, so you need to make sure you create a team. You need to make sure you get educated on what's going on. You make sure you get a second or third opinion if you need to. It's interesting when I tell a patient get 2 or 3 opinions, 3 different oncologists with 3 different opinions. Now you talk about frustration. Now they're really frustrated. Who's right? Who's wrong? So you want to make sure you figure out exactly what's going on. How did this happen? We begin to get the testing done as fast as possible. And in the meantime, yes, you may have to start minimizing that tumor load. I don't believe in that you just can only do natural. I mean, I have patients who want to do conventional. Their families into wanting to do radiation or chemotherapy or surgery, and I ask them on a scale of 1 to 10, where are you? And if they say 7, 8, 9, 10, they better do it, because if they don't, they're going to regret it, right? Or somebody else is, and that's their choice. Or they say, no, I'm a 0, I don't want to do it at all. Well, then you better not do it, because if you think it's going to work, it'll work better. And if you don't think it's going to work and you do it, it's probably not going to work as well. So you got to make sure you know exactly what you're going to do. If you're going to do chemotherapy, radiation, or surgery, protect your body. Protect the body, making sure that you're protecting the healthy cells. And then it doesn't matter whether you get or surgery on your tumor or radiation, you're only minimizing the tumor load. You have circulating stem cells. This is systemic. It's in the blood. Run the right test, you'll still see it. And you have to get rid of what's in the blood still. That's why they'll usually do surgery. They say we have clean margins, and what do they still do? Full-blown chemotherapy and radiation still most of the time. Why? Because they know it's systemic there. So get a plan together. Relax, create a plan, create a team.